This is, I think, a really important piece here. The essentials of advocacy, collaboration. You know, collaboration is where we have wonderful things happen. When people work together as a team across the home and school environment, when the parents feel that you know, their efforts are really respected and vice versa, people do beautiful things. And I've seen some wonderful collaborations happen. So collaboration is the act of working together with one or more people in order to achieve something. It gives the opportunity to brainstorm, to discuss and share knowledge and information about effective practice, about good practice. And it allows for sharing of expertise and experience across disciplines. Because autism is not a neat and tidy disorder, right? It's not something that, it's not a physical disability in that you may need the support of a great OT to deal with that, maybe some help from a physical therapy, but it's really an all-body experience, right? And it's an all-environment experience. It's across the age spans. So when you get people who can collaborate together and bring their experiences from working with a number of children to bear and to feel heard, that is really exciting. One of the things that we're very concerned about at ACT is the lack of collaboration in the teams that evolve around, particularly preschool children. You know, there's a lot of people involved. There tends to be a lot of egos involved. There tends to be an awful lot of professional, there's not a lot of money. Each profession thinks that they have the biggest role to play in autism intervention. And for the parent, they're often trying to make decisions about where are they going to put the small amount of money that they have, right? It's a tough decision. And, you know, we can't make any broad generalizations. But we do think that the role of professionals is very important. So if you're tempted just to hire a behavior interventionist and forget about hiring a behavior consultant, that concerns us, or not have the support of a speech-language pathologist. It depends where your child is. But without proper supervision, professional supervision, program time can often be wasted. So you might think it's just the hours of time that the child has with someone who you think is qualified, but a behavior interventionist without a supervisor is not somebody who has the skill set to put a program in place that's going to do your child the best, you know, make the best use of that funding. So we say to families, you know, this is not childcare you're paying for. This is actually intervention. And it's better, you know, it's better if you have fewer hours with a behavior consultant or a speech-language pathologist who are going to train the parent as part of the intervention team, right? So that you can do therapy in the, you know, in the bath, at bath time, at sleep time, on the way to the grocery store, in the grocery store. If you understand about helping the child identify vegetables and fruits and, you know, getting them engaged, you can make that money go much further. If you're hiring someone whose only qualifications to work with your child is that they're over, you know, that they're 19 and they have a criminal record check, I think you can understand that that's not a very good use of your time. So I think that's really important. I can't say to you, for your child at this time in their development, the most important thing is a good behavior consultant or analyst or a speech-language pathologist. Those things change. A lot of the time we do advise that families try as much as possible not to do direct service by professionals, but actually have, you know, behavior consultants, speech-language pathologists, OT, providing consultation to the team, to the parents and the behavior interventionist, because a professional may cost well over $100 an hour. A BI is a lot cheaper, but they need supervision, they need input, and the program needs to be continually refreshed and revised. Otherwise, the kid gets bored, and you start getting behaviors not because they don't understand, although that could be the case, but because they're really bored, because they've done this about 1,000 times, and still they're being asked to do it, and it's not meaningful. So, okay. So again, we talked about the HUCO decision and collaboration, that collaboration means people from the community, people from the home team, working with people in the school team. one of the concerns that we often have coming from the schools is that the professionals, particularly behavior consultants working with families in home teams, are not particularly respectful of the school team. And often you'll see very young behavior consultants, and sometimes not so young, going into a school meeting and not recognizing that they're no longer in the family home and that they actually have to work as collaborators. They don't give directives, right? So it's all about understanding as a parent, when you see that happening, when the behavior consultant isn't respectful in the team, that's not helping your child, right? Sometimes it's a matter of, and it's very subtle. Sometimes it's a matter of going to the principal and saying, I don't see this isn't working very well. Can you give me some feedback? And the principal can then perhaps tell you, we do welcome behavior consultants from the community. However, we have some problems of communication here, and it's getting stressful because that's getting in the way of your child's program. So you need to be thinking about, because you're effectively the employer of that behavior consultant, if they're not acting on behalf of your child, of your child's interest, that's a problem, right? And again, it's very subtle. It's difficult to deal with. We see many families who have this problem. And we've also brought it up with behavior consultants themselves about the need to behave professionally and collaboratively in the interest of the child. Many behavior analysts or behavior consultants are frustrated because the schools don't listen, and they can see what's happening in the school not going well for the child. So that's when you sit down with the behavior consultant that you have and talk about how you advocate effectively to do that. And that isn't necessarily by having an argument in a team meeting.